Ethnicity Data Collection in Irish General Practices, a research summary from the EMIC project, which stands for Ethnic Minority Health in Ireland, Co-Creating Knowledge. My name is Professor Anne McFarlane and I'm the Chair of Primary Healthcare Research in the Medical School in the University of Limerick. I'm Principal Investigator for the EMIC project, and this is Professor Ailish Hannigan, Associate Professor of Biomedical Statistics, who led the quantitative research in EMIC. This research was developed through the Partnership for Health Equity, which is a partnership between the HSE Social Inclusion Office, North Dublin City GP Training Programme and the University of Limerick Medical School. The research was designed and conducted with community partners, Intercultural and Diversity Education Centre Ireland and Shannon Family Resource Centre. It was funded by the Health Research Board. The aim of this research was to advance knowledge about ethnicity data collection in Ireland. This short film introduces the concept of ethnicity and why it is important for health. It includes a clip from a community drama which summarises findings about the ideas community members and GP staff had about collecting these data in general practice settings. The findings highlight important issues about how these data are collected and used to address any identified health inequities between ethnic groups. Ethnicity is a term used to refer to a group of people who identify with each other because of a shared and distinctive culture, ancestry, language, religion, or nationality. It is considered to be a complex concept because it is subjective, based on a feeling of identity, and it can change over time. Ethnic group should always be identified by the individual and should not be assigned to them by others. It is difficult to measure, and not all countries record it, often for historical or political reasons. In Ireland, ethnicity has been recorded since 2006 in the census of the population using this question. This question will change in 2021 with new categories added. If none of the categories are relevant, an individual can write in a description of their ethnicity. Country of birth is also recorded. In the 2016 census, 8 out of 10 people in Ireland identified as white Irish. 1 out of 10 identified as any other white background, including many people born in the UK and Poland. 1 out of 10 identified as all other ethnic groups. If we consider ethnicity in the context of health, we're interested in recording it so we can find out how many are in a particular group and then calculate the rate of disease, healthcare access and health outcomes in that group. This is an equality monitoring measure and allows us to identify differences between groups and to intervene where necessary to improve outcomes. In other words, if we don't collect ethnicity data, we don't know if there are differences between groups. And if we don't know about any differences between groups, then we can't do anything about it. Equality monitoring in the health services is a requirement under Section 42 of the Irish Human Rights Equality Commission Act 2014, referred to as the public sector duty. Quality monitoring is a priority in the HSE National Intercultural Health Strategy and is recommended by the World Health Organization Strategy and Action Plan for Refugee and Migrant Health. The Health Service Executive has developed an ethnic identifier which would record ethnic group, country of birth, language spoken and religion. This suite of questions is considered a holistic approach to identifying and addressing the needs of patients from diverse groups. Ethnicity is already recorded in some settings, for example psychiatric hospitals, and notifying some infectious diseases. But it is not routinely recorded in general practice where most of us access care. Ethnicity is considered sensitive information. However, we know very little about GP and community members' views about ethnicity data collection. The aim of our research was to identify community and GP views about recording ethnicity in general practice settings. We wanted to know, does it make sense to them? Would they engage with the data collection process? There were 70 people in this research. There were 62 community members comprised of Irish travellers and migrants, and there were 8 GPs, and all of the participants were living in the Midwest of Ireland in either a city, town or rural area. All data were collected using focus groups or interviews. Our analysis found that participants are broadly in favour of the rationale for ethnicity data collection, but there were concerns that warrant attention. We worked with a community drama company, Theatre for Change from Galway, to summarise the research findings. Theatre for Change Galway encourages audiences to interact with the actors to explore the issue being examined, and you can see some pictures of that here. The drama, which was called Diversity in Data, was performed 3 times in community settings, in a family resource centre, a community hall and in a church. The drama is set in a GP waiting room, and as patients start to arrive, they're asked to fill out an ethnic identifier form and to step into a box, a dramatic device to visually explore what ticking a box about ethnicity can be like. You will see that they have many different perspectives about this. So, sit back, relax and enjoy the show.
Little boxes on the hillside, little boxes made of ticky-tacky, little boxes on the hillside, little boxes on...
Oh, it's cold outside, Hannah. Hi, Rose, is it? Lisa?
Oh, yes.
From HSC?
Yes.
I'm here to set up the survey.
Okay.
Right. You don't have to do much at all. So what we have done is we have prepared these forms, all right? And what we're looking at collecting is quantitative data about the patients coming into your healthcare service here, right? So we are looking, the form is looking at the country of birth, at the language spoken at home, religion, and especially ethnicity.
And how will details on country of birth, ethnicity, and that help?
Oh, so we need to do this in order to, because of public sector duty, so to improve our services.
And is it anonymous? I don't see any place for a name.
No, okay, right. Rose. So, I'll explain a little bit more. You have a piece of paper here as well with all the background and all that. But, so we need to do this as we are collecting the ethnicity and culture background, because some populations actually will have certain conditions, certain areas that would be problematic in health, right? So if we know the patient's ethnicity, then we can actually anticipate the needs of the people coming into your service, and therefore we can improve the services. So this is already worked out in Scotland. They're doing it, okay, and the NHS have really developed their services by doing this, and we are actually already doing it in Ireland. Healthcare providers are already doing it, but HSC need to streamline it.
Okay. Yes, patients might ask me to explain.
Oh yes, of course. And in addition to that, they have some very innovative way of collecting research. So we have these boxes here, and what I would like you to do is not only to fill in the forms, but the patients, ask the patients to step into a box according to their ethnicity, and what you do then is to record the frequency, well, what boxes are being used, and the frequency of it.
So the number of people that step into each box.
That's right, that's right. It's all the numbers, all the numbers. Right? Rose. Oh, hello. Dr. Murray, is it?
Lisa.
Oh, sorry. Yes.
Lisa.
We spoke on the phone, Lisa, that's right.
You did.
I just briefed Rose on the research.
Rose, I'm so sorry to give you more work, but Lisa and I spoke, and with the amount of time that I have, the limited time I have with our patients, I don't think it would be, I'd be able to do it myself. So maybe giving them a form to fill out might be a better way of doing it.
And the boxes?
Oh yeah, any way we can collect this information is great. It has to suit you, of course, but it's for the greater good in the end.
I'm very interested in it.
Yeah.
I'm looking forward to seeing the results. Oh, I think, excuse me girls, I have to go and start surgery. Talk to you
We'll be in
later.
touch, thanks.
Hey, good morning. Yeah, my
good
name is Adedura Donnelly. I'm here to see Dr. Murray. Donnelly. Adedura Donnelly. Just put in Miss Donnelly.
Miss Donnelly. Dr. Murray, he's running about over 5 minutes late, but while you're waiting, we would really appreciate if you filled in this form. Please.
Another form.
I know.
I feel everywhere I go these days, I feel forms.
I know.
Why?
But if you read it, it kind of explains why we're using it.
Okay. When you using it? Oh. Okay. I feel it has to be
Yeah,
to
if
be
you look
done.
there, and you might need to buy it.
Oh, okay, okay. I think it has to be done. Where are the chairs?
Oh,
What
sorry.
are the chairs?
If you
What's
look at
this
the
one?
right-hand side there, it kind of explains things. You have to step in the box according to your ethnicity.
Ethnicity?
Yeah, on the right-hand side.
Really?
We would really appreciate it if you fill it in.
Okay. I think it has to be done.
Hi, Sam.
I'm here to see Dr. Smith.
How are you?
Not great.
Sam, Dr. Smith now, yeah, he's running about 10-15 minutes late, but while you wait, would you mind filling in this form? It's anonymous, and we're kind of trying to collect information about the service.
Oh my god, not another form. You know how I feel without giving out my personal details. You never know where it goes or who gets to see it.
Sam, just fill it in. It's to help the service. You would be helping us.
Well, we all know how that works, don't we? What is this? Apartheid?
This is not right. Not easy at all. I feel I have to be in and just play along and fill the form to get service here. Oh, you don't know when someone will use your non-Irish against you. You know?
I don't care today. I'm really not in the mood. I'm not feeling very well. I'm just going to see the doctor.
This is very interesting. I love these new innovative ways they have of collecting data. You know, my daughter lives in Sweden and she works in research. And she tells me about all these wonderful methods they have for collecting data. Oh, yes. Well, here's me. White Irish. I tell you, sorry. Ethnicity. Okay. Well, this is kind of tricky. I don't think I can. I've never lived here before. I've never lived in Ireland. I'm travelling all my life. Oh, Irish traveller. Okay.
Jean.
Yeah.
I'm sorry.
Oh.
You can't go in that box. That's an ethnicity and it's all right.
Okay.
As I say,
Sorry.
if you read the form here,
Okay.
you probably fit into White Irish.
White
But,
Irish. Oh. Okay. White Irish. This doesn't really make sense to me. There's no way to just go here.
Like 3 times now, I've filled form like this. For the past months, they say they have, I'm sick and tired of this. They say they have law to keep the data. I don't think we are any safer. And I don't know where it goes in the end.
Data is constantly harvested to fill company coffers and help the state maintain control. Personal information is big business these days.
Conspiracy theories. Conspiracy theories. How do you think we have the service that we have now, except by gathering information? Honest to God. You know, my daughter lives in Sweden, and she tells me that all you have to do is give out your PPS number, and they have all the information that they need about you. It makes the whole system much more efficient and so much easier.
you say it's easier for you. But if I would have lived in Sweden, it would not make it easier for me at all.
Well, I'm sorry you feel like that.
How would this information prove your service to me?
Well, I know I don't know the ins and outs of it, but I do know that it's in Scotland it works.
See, in Sweden, I bet you they have the same thing as well. You know, my daughter tells me that all mothers in Sweden breastfeed their children, as do the Polish. Now,
And if you're ethnically Irish, you're more likely to get cystic fibrosis or celiac.
oh, well, I didn't know that. But you see how important it is now. And I bet you that if you're from Africa, you might very well have malaria.
And
No, come on, I don't agree with that now. I mean, all right, I might be white and an Irish citizen, but in relation to my health, is it not more important to ask me the countries that I've been travelling in for the last few years? I mean, come on. Like, look, you could have a Kenyan passport, which could be living here for the last 20 years.
I'm finished with my form. I wonder, could I see Dr. Murray now?
No way! You can't go before me. I'm here before you. What do you want?
I was just trying to be more efficient. You see, I have my form filled in. You haven't even started yours.
Being you fill your form doesn't mean you get to go before me. That would be discriminating. Oh, it would be discrimination.
This sensitivity kills me. When can I see Dr. Murray?
I'll come back when sanity prevails.
Oh, Sam, you haven't even filled in your form. Help!
Little boxes on the hillside, little boxes made of ticky-tacky, little boxes on the hillside, little boxes all the same. There's a pink one and a green one and a blue one and a yellow one, and they're all made out of ticky-tacky and they all look just the same. And the people in the houses all went to the university where they were put in boxes and they came out all the same. And there's doctors and lawyers and business executives, and they're all made out of ticky-tacky and they all look just the same. And they all play on the golf course